I'm going to say something that surprises a lot of my patients. Water can help your blood sugar, or quietly make it worse. I'm Dr. Alaric, and today I'm going to show you one very common way seniors drink water that spikes blood sugar, and a safer way most men were never taught. If you have diabetes or you're pre-diabetic, this matters. Let me tell you what you're going to learn today. First, how the timing and amount of water you drink affects your blood sugar, especially after 45. Second, the one mistake I see almost every week in my clinic. It's so common that most men don't even realize they're doing it. Third, a simple way to drink water that supports steadier numbers throughout the day. And fourth, when water alone is not enough and what that actually means for you. This isn't complicated, but it does matter. Let me explain something quickly in plain English. When we drink water, it changes three things. It changes blood thickness, it changes hormone signals, and it changes how fast sugar moves from the food we eat into our bloodstream. As we age, our thirst signals get weaker. Our kidneys change the way they handle water, and many men drink water only when they feel dry. That pattern can backfire if you have diabetes. Your body doesn't always tell you what it needs when it needs it, and by the time you feel thirsty, your blood sugar may already be reacting. Let me tell you about the most common mistake I see. It's what I call catch-up drinking. Here's what happens. A man wakes up. He skips water in the morning because he's rushing or he doesn't feel thirsty. Maybe he has coffee instead. He goes about his day. By mid-afternoon, he realizes he's had almost nothing to drink. So he chugs. He drinks 2, maybe 3 glasses in a row trying to catch up. And his blood sugar doesn't like it. Why? Because when you drink a large amount of water all at once, especially after hours of dehydration, your body scrambles to adjust. Your blood becomes thinner very quickly. Hormones like insulin and cortisol respond. And if you've been sitting for hours without movement, that big gulp can trigger a swing. It's not the water itself, it's the pattern. Let me give you an example from my own clinic. John, 62 years old, came in frustrated. His fasting blood sugar was decent, but every afternoon around 3 or 4, it spiked. He couldn't figure out why. We went through his meals, his medications. Everything looked fine. Then I asked him about water. Turns out, John drank almost nothing until 3 in the afternoon. Then he'd chug 2 full bottles because he suddenly felt parched. We didn't change his meds, we didn't change his food. We just changed when he drank water. Small amounts spread evenly through the morning and midday. Within a week, those afternoon spikes dropped. Here's what most men don't realize. Morning dehydration is real. You lose water overnight through breathing, through your skin, even through digestion. By the time you wake up, you're already behind. But your thirst signal, it doesn't kick in right away, especially as you get older, so you wait. You drink coffee, which makes you lose even more water. And by the time you feel thirsty, your body has been running on low for hours. That's the catch-up trap. Big gulps versus steady sips. It sounds simple, but I see men struggle with this every single week. Your body likes predictability. It likes rhythm. When you drink water steadily, your blood sugar has time to adjust gradually. When you flood your system all at once, it reacts. And if you're on medications for diabetes, this matters even more, because those medications are designed to work with your body's natural rhythms. If you disrupt those rhythms with irregular hydration, the meds can't do their job as well. Now let's talk about timing, because here's the truth. How much water you drink is important, but when you drink, it matters even more. Let me ask you something. Do you drink most of your water with meals? Or after meals? Or late at night before bed? A lot of men do. And that timing can quietly affect your numbers. Here's why. When you drink a large amount of water during or right after a meal, it dilutes your digestive enzymes. That slows down how your body breaks down food. And when food breaks down more slowly, sugar enters your bloodstream in unpredictable bursts instead of a smooth curve. For someone with diabetes, that can mean a delayed spike. You eat. You feel fine for an hour, then suddenly your sugar jumps. The safer pattern? Small amounts of water 15 to 20 minutes before you eat. Not a lot, just enough to hydrate your system and prepare your stomach. Then, wait at least 30 minutes after eating before drinking more. This gives your body time to process the food without interference. Let me tell you about Samuel, 58 years old. He came to me because his fasting blood sugar in the morning was always high. We checked his evening routine. Turns out, Samuel drank most of his water after dinner, 2 or 3 glasses right before bed. He thought he was doing the right thing, staying hydrated overnight. But here's what was happening. All that water late at night was affecting his kidneys while he slept. His body had to process it, and his fasting numbers the next morning stayed elevated. We made one change. We moved his water intake earlier in the day, morning and midday, just small glasses spread out. His fasting numbers started to stabilize within 2 weeks. Now, does this mean you should never drink water at night? No. Some men need to, especially if you're on certain medications or if you have kidney concerns. But for many men, drinking most of your water late in the evening keeps your system active when it should be resting, and that can affect your morning blood sugar. There's also something called the danger window. For most men with diabetes, it's late evening, between 8 and 10 at night. That's when your body starts shifting into rest mode. Your metabolism slows. Your liver starts releasing stored sugar to prepare for the overnight fast. If you flood your system with water during that window, you can disrupt that process. Again, this isn't about avoiding water, it's about respecting your body's natural rhythm. And here's something else. If you're on diabetes medications, the timing of your water matters even more. Some medications work better when taken with a small amount of water. Others need to be absorbed on a relatively empty stomach. If you're drinking large amounts at the wrong time, you might be reducing how well your medication works. I'm not saying stop drinking water with your meds. I'm saying pay attention to when you're drinking the rest of your water throughout the day. Small shifts, big difference. Let's talk about the fancy stuff. Cold water, warm water, alkaline water, electrolyte drinks, mineral water. I get asked about these all the time, and here's the truth. Most of it doesn't matter as much as people think. Let's start with cold water. There's a myth that drinking ice-cold water spikes your blood sugar because your body has to work harder to warm it up. That's not true. Your body does use a tiny bit of energy to warm cold water to body temperature, but it's so small that it has no meaningful effect on your blood sugar. What can matter, though, is how cold water feels. If you chug ice-cold water on an empty stomach, especially first thing in the morning, it can cause a shock to your system. Some men feel lightheaded. Some feel a spike in heart rate. That's not blood sugar. That's your nervous system reacting. So if you prefer cold water, drink it. Just sip it slowly. Don't shock your system. Warm water? Same thing. Some people say warm water is better for digestion. And for some men, that's true. It can feel gentler on the stomach, but it doesn't lower blood sugar. It doesn't cure diabetes. It's just easier for some people to drink. If warm water helps you drink more steadily throughout the day, then it's helpful. Not because of magic, because of consistency. Now let's talk about electrolyte drinks. These are popular, especially among men who work outdoors, or who exercise, or who sweat a lot. And yes, electrolytes matter. Sodium, potassium, magnesium, they help your body hold onto water and maintain balance. But here's the problem. Most electrolyte drinks contain sugar, sometimes a lot of it. I had a patient named Mike, 66 years old. He switched from plain water to flavored electrolyte drinks because he thought they were healthier. He saw athletes drinking them on TV. He figured they'd help his energy. His blood sugar didn't agree. Those drinks had 15, sometimes 20 grams of sugar per bottle. Mike was drinking 2 or 3 a day. That's an extra 40 to 60 grams of sugar he wasn't accounting for. When we switched him back to plain water, his numbers dropped within days. Now, does that mean electrolyte drinks are bad? No. If you're sweating heavily, or if your doctor specifically recommends them for low sodium or potassium, they can help. But for most men managing diabetes, plain water wins. If you want electrolytes without sugar, look for zero sugar versions. Or eat foods naturally rich in potassium and magnesium, like bananas, spinach, and nuts. What about alkaline water or mineral water? Again, these aren't harmful, but they don't treat diabetes. Alkaline water has a higher pH. Some people say it reduces inflammation or balances your body's acid levels. The science on that is weak, and it definitely doesn't lower blood sugar. Mineral water contains trace amounts of minerals like calcium and magnesium. Those are good for you, but you'd get the same benefit from eating a balanced diet. The bottom line, plain water is almost always your best choice. It's free, it's simple, it doesn't spike your sugar, and it does exactly what your body needs. Alright, let me give you the exact instructions I give my patients. Tonight, before you go to bed, pour 1 normal glass of water. Not a huge bottle, just a regular glass. About 8 ounces. Tomorrow morning, when you wake up, take 3 slow sips. Then wait 20 seconds. Then take 3 more. Don't chug it. Don't rush. Just 3 sips. Pause. Repeat. Do this once in the morning, once around midday, and once about 30 minutes before dinner. That's it. You're not trying to drink a gallon. You're not trying to force it. You're just giving your body small, steady amounts throughout the day. If you feel dizzy, stop. If you feel unwell, stop and talk to your doctor. Some men have kidney issues. Some men are on medications that limit how much water they should drink. This isn't one size fits all, but for most men, this simple pattern works. Small sips, spread out, no catch-up drinking. Your blood sugar will thank you. Now, before we go any further, I need to talk about warning signs, because water is simple, but your body is not. If you experience any of the following, stop what you're doing and talk to your doctor right away. Frequent dizziness, especially when you stand up. Swelling in your legs or feet that doesn't go away. Very dark urine, even when you're drinking water. Sudden drops in blood sugar that feel different from normal. And needing to urinate all night long to the point where you can't sleep. These are not normal, and they're not something you fix by drinking more or less water. They're signs that something deeper is going on. Maybe with your kidneys, maybe with your heart, maybe with how your medications are working. I've seen men ignore these signs for weeks, thinking they just need to adjust their water, and by the time they come in, the problem is harder to fix. Don't be that man. If something feels off, get checked. I want to say something. I see how hard men try. You're managing medications, you're watching what you eat, you're checking your numbers, you're doing everything you're supposed to do, and sometimes it still doesn't feel like enough. I get that. But here's what I've learned after years of working with men like you. Sometimes it's not about doing more. It's about doing it differently. Water isn't going to cure diabetes. I'm not going to tell you it will. But small changes in how you drink, when you drink, and how you think about hydration, those can make daily management feel a little easier, a little more predictable, and that matters. Here's something I've noticed. Some men make these changes and see steadier blood sugar numbers within days. Others don't notice much difference for weeks, and a few don't see a change at all. Why do you think that is? I have my theories, but I want to hear from you. Tell me in the comments below. What's your experience been with water and blood sugar? Have you noticed patterns? I read every comment. Let me answer a few questions I get all the time. Question 1. How much water should I drink daily? Honest answer? It depends. It depends on your size, your medications, how well your kidneys are working, whether you sweat a lot or live in a hot climate. The old rule of 8 glasses a day? That's a rough guideline. But it's not gospel. For some men, 6 glasses is plenty. For others, 10 is necessary. More isn't always better. And if you're on diuretics or heart medications, drinking too much can actually be harmful. Talk to your doctor. Get a personalized answer. Question 2. Can water lower blood sugar fast? No. Water supports balance. It helps your body process sugar more predictably, but it's not a cure. It's not a quick fix. If your blood sugar is dangerously high, water alone will not bring it down. You need medication, movement, and medical supervision. Water is part of the puzzle, not the whole solution. Question 3. Is drinking water at night bad? For many men, yes, but not all. If you're waking up with high fasting blood sugar and you're drinking most of your water late in the evening, that could be part of the problem. But if you have kidney disease, or if your doctor told you to drink water at night for a specific reason, then you should keep doing it. That's the key difference. Context matters. Water is simple, but it's not simplistic. The way you drink it, when you drink it, and how you think about it, all of that plays a role in how your body manages blood sugar. If this video helped you think differently, I'd appreciate it if you'd subscribe to this channel. I make videos like this every week, focused on men's health, aging well, and living stronger after 45. Share this video with a man you care about, a brother, a father, a friend, someone who's managing diabetes and might not know about this. And leave a comment below. Tell me what's your biggest struggle with blood sugar. What patterns have you noticed? What questions do you still have? I read the comments, I learn from them, and I use them to make better videos for you. Thank you for watching. Thank you for taking your health seriously. And thank you for trusting me with your time. Take care of yourself.